Welcome to Synchronicity, talk radio for your mind, body, and soul. I'm your host, Marie Benard, and today we are speaking with Jan Mundo. She's the author of the HEALER'S Handbook, a holistic, hands-on, somatic self-care program for headache and migraine relief and prevention. And Jan has held headache programs at medical centers, universities, and corporations, including Kaiser Permanente, Stanford University, and Apple. She's a certified master somatic coach and a massage therapist with advanced training in multiple healing modalities. You can find her at theheadachecoach.com. Welcome to the show, Jan.
Thank you, Marie. It's great to be here.
Thanks for being with us today. So this was, I kind of sometimes get headaches, and I woke up with a headache this morning. So this is perfect timing. I'll have lots of questions for you, but maybe you can tell us a little bit about your journey and how you became such an expert on headaches.
Sure. And it's very interesting that you said that as far as waking up with one, because you're the second host in an interview that that's happened with. And so it, maybe just thinking about it, or who knows why, but it does give an opportunity for us to work at that level. So thanks for sharing that with me. I got started, I think, unknowingly, really. When I was a little kid, my mom used to have migraines. And so she would get some relief by my, she'd say, oh, just press here on the back of my neck and iron out what she called the knots, the tightness in her neck and shoulders. And she had the typical migraine symptoms, would be lying down in a dark room, not able to move, not able to speak, an ice pack on her head, curtains drawn. And so that was around me. At the time, she would take some of the heavy medications that were given back in the day, and they had codeine and other things in them, and so I kind of grew up around that, but I didn't really have them myself. And then around 1970, I'm dating myself, but there you go, I heard of a claim and learned how to stop a headache on the head with my hands. I heard that if you put your hands on the front and back of somebody's head, that you could stop their headache or migraine. And I, at that point, had them occasionally. And so that would work for me as well. My ex-husband would do it on me, and I would start to work on myself as well. And when I figured out and learned how to stop them on myself, I seemed to become a magnet for people who had them. So wherever I was, whether I was at a family gathering, a party, a makeup counter, these are just times that come to mind. Shopping at the Gap, someone would say, oh, I've got such a headache, or oh, I've got such a migraine, I have to go home, I have to leave the party, I have to lie down, I feel miserable, I have to go take my pill, whatever it was. And so I was curious each time. I didn't really know what I was doing or how I was doing it, but I was really curious about, let me see if this will work again. So I'd say, well, I can help you if you just give me 5 minutes. And so I'd take them aside, either into a dressing room, corner of a room, somewhere that was a little more secluded. And I would put my hands on their head and I would do my thing. And lo and behold, about 10 minutes later, their pain would be gone and they'd perk up, and their coloring would change, whereas they might have looked pale or felt nauseated at the time. They would just perk up and say, I feel better now, and they'd go back about doing whatever they were doing. And so that went on for about 21 years.
Wow.
Should I go on?
Yes.
There's more to the story.
Keep going.
So I wasn't really getting them that much, although I had them occasionally, but I didn't really think about it that much, and was able to stop them with this hands-on technique. And then, and I was also living a more natural lifestyle. I lived in a spiritual community / commune in the woods in Tennessee. We ate really healthfully, We grew all our food. We didn't have packaged products. We preserved and made all our own food. And at the time, we were on vegan diet. We were in the country, so there was less stress. We were in nature. We meditated. And so I didn't really have that many, although some people around me did. And so I also got practice on them as well. Then in about 1990, the late 80s, early 90s, I started going into early perimenopause. So I was only in the early 90s, I was around 40, and I started getting these symptoms that I had no idea what was going on. So I would wake up in pools of perspiration, basically of water, lying in bed, and would start getting hot flashes and mood swings and migraines. And my migraines were really strong. And at that time, I didn't realize that migraines increased a lot of times in women during perimenopause. Because your hormones are kind of all over the place at that point. But what I did notice was that I was going through more stressful times myself. I left the community. I was living back in Santa Monica in California. I had gone through a pretty intense divorce and child custody, and my kids were living with me in the city, and they were adapting to city life for the first time because they'd been raised in the country. So there were a lot of changes, and my hormones were going through changes. And what I realized was that I could time my periods by my migraines, because I would get a really intense migraine the day before. But then I also started reading a lot about menopause, about the mind-body connection, about how your thoughts and your breathing and what you eat and drink, how those influence your body and your cycles and all that. And so I started meditating, I started eating better, I started exercising more frequently, I started drinking more water. So I realized that when I was under less stress and living a more balanced existence, that I actually wouldn't get that migraine the day before my period came on. So that led me to begin designing, along with the hands-on therapy, this mind-body program where I taught all these things that I'd been learning and really put together different things into a program. And then I began teaching at medical centers. And I got my first few patients from a neurologist and headache specialist at UCLA. So I put it all together because I realized that when life was more in balance and all your ducks were in a row, that the migraines, that you could really manage them and even prevent them from coming on.
Thank you, Jan, for sharing that. And you actually mentioned that the neurologists were sending their patients to you. So these are headache experts, medical doctors trained in dealing with it, and they were sending some of their hardest patients to you.
Yes. Yes. Because some people didn't want to do medications, and for some people, the medications weren't helping. So, and the first doctor that began sending patients to me, she thought that I had a really interesting story and was interested in what I was doing. And actually, when she first did, I wasn't doing the whole prevention program. That's when I was first learning about it. And also I was reading a lot of the medical and consumer literature about headaches and migraines because I didn't really know much about them at all. I just intuitively had been doing this therapy on the head. And that neurologist, Dr. Susan Perlman at UCLA, actually sparked me to creating the prevention program, because she said that the hands-on therapy was successful in relieving their pain, but not in preventing it, which I had known. But that was a challenge. That was thrown down like a challenge to me. And that's how I read it anyway. And so I thought, well, I'm learning all this and I'm learning how to prevent my own. I'm going to create this program. And then that's what I did. So just that follow-up letter that she sent to me was like a prompt to go further and not only relieve, but prevent.
Thanks, Jan. We are speaking right now with Jan Mundo. She's the author of the Headache Healer's Handbook, a holistic, hands-on, somatic self-care program for headache and migraine relief and prevention. And Jan, you're going to be doing an online workshop or course to help people. Do you want to tell us a little bit about that?
Yes. So I'll start with, it's going to be the Headache Healer's Handbook live. Mm-hmm. So it'll be a video conferencing workshop, and it will be a way to help people walk through the book and to place themselves and really help guide them through walking through the book, and point out certain things that are important. And, the book really is very comprehensive. And so this will be a way to help plug them in and help keep them moving along through it. And so we'll cover the whole book in an 8-week program, about 1.5 hours a week. And then there will be also various levels at which they can join. They can join just to listen, or they can join and have me also assess their headache history questionnaire and their headache diaries that they'll be recording in each week. And there'll be other levels where they can receive individual coaching from me.
Thank you. And so if people want more information about that, they can go to theheadachecoach.com.
Yes.
Perfect. And you mentioned that headache history questionnaire, and I started going through it, and I realized that unless I'm actually having a headache, it's hard for me to answer some of the questions, like where it's coming from, what it feels like, is it a throbbing, is it all of those kinds of questions. I haven't been aware of enough, I haven't been paying close enough attention to the type of pain and the things that, like the precursors that come before it. So can you tell us a little bit more about maybe people want to, before they go out and buy the book, as they're listening right now, want to be paying attention to, if they are starting to get a headache, what it kind of feels like. And can you walk us through a little bit of that?
Sure. And that's really interesting what you said, though. So maybe you can find yourself in some of these descriptions that I'm going to give. And the descriptions that I will give are based on the International Classification for Headache Disorders, which is from the International Headache Society, and the American Headache Society doctors that have come together, neurologists and headache specialists, to provide a way of diagnosing headache patients. And largely it's the diagnoses and the criteria that they use are so that doctors can prescribe medications and also know how to classify the different types of headaches and different characteristics and qualities that people have when they're having headaches. However, in my practice, which is really a coaching practice, I'm not a doctor, I don't diagnose. So how I describe them is also with qualities that you can actually feel. And what I'm looking for are, and helping people look for when they're looking at these characteristics is, like you said, be able to become more aware of where their pain is in order for them to work on it as far as in the somatic or mind, body, emotion, spirit realm, because that's how I work with them. So I'm not working with medications, and I'm not part of that loop. Mm-hmm. So it's a way to help people be able to tune in to what they are feeling, just as you expressed, right? And be able to see also what parts of the program that they will be going through in the book will be most appropriate for them at certain times. So I'll start with some of the descriptions, and then I'll describe or talk about what I just meant.
Okay.
How's that?
Thanks, Jen.
Okay. So the most common type of headaches are tension type headaches or tension headaches. And those are what you might think. They're characterized by a tightness or tension. And a lot of times those are described as feeling like a tight hat band around your head. So that whole area of where a hat band would be around the circumference of your head feels tight or seized up. And then that also can extend into the forehead and the back of the skull, the neck and shoulders, so this tightness or tension. And they're not so much pulsing or pounding as much as they are just tight or held. Another way they're described is your head being held in a vice grip. So it's just like a squeezing, tightening feeling. Okay, so those are tension type headaches. And then most of the people I see have migraines because those are considered more disabling than tension type headache, although tension type headaches can also be disabling. And migraines are characterized by a pulsing pounding on the head, and usually it's in your temple area, your forehead. Some people feel it on the top of their head. Some people feel like a stuck knot in the back of their head, or stuck in their shoulders, or in the back of their neck, kind of like what my mom described, right? Like these knots in the back of their head or neck and this tightness, but largely there's this pulsing pounding. But the thing about in the front of your head, and also it can be also on the sides, I should say too.
So can I stop you for a second, Jen? So if you have one of those headaches where you can feel your pulse in your head, that might be a migraine?
Yes, like you feel it on the inside, like pounding, yes. And the other thing about migraine is that, as they say, it's not just in your head. So it's more like a whole system phenomenon. So you can get symptoms before the actual pain, and those aren't only in your head either. So and they vary with person to person. But there are some common ones, but not everybody has all of them, and some people don't have any of them. So some of the precursors are what are called prodrome, which can happen a day or two beforehand, or even up to 3 days beforehand, are that you can have sense disturbances. So your sense of smell might change. You might smell odors more strongly. Like you could just be walking down the street and all of a sudden you'll be smelling car fumes more strongly, or foods, or whatever, or scents from plants. Like you can smell things more strongly. Like they just kind of jump out at you and pervade your whole system, whereas a day before you could have walked down the same exact street with the same exact odors and nothing would have caught your attention or bothered you. The same thing can happen with your eyes. So your visual sense, lights can seem really bright and can bother you, like kind of disturb your whole visual field. And then also your hearing. So sounds might seem extra loud. Car sounds, construction sounds, sounds that aren't even that loud could bother you. Music that wouldn't have bothered you at all. So they'll bother you and you'll notice them. Some people get nausea, some people have vomiting, so some people their mood changes, some people they get more sleepy. Some people get certain food cravings. So those can all happen. And then in the several hours before you get a migraine, there's another set of symptoms which are called aura. And aura, a lot of times they're largely visual, but those can also vary. And those can be frightening for some people because they can be so extreme. You can have flickering lights, spots, part of your visual field can disappear. People can see zigzaggy lines. There are all sorts of things that jump out at you. So those are some of the symptoms. And then
can I stop you for 1 second there, Jan? I know you're not a medical doctor, so you might not have the answer to this, but you mentioned aura before a migraine. People who get seizures sometimes have auras as well, and it makes me wonder if seizures and migraines might somehow be connected.
Yes. So you're right. I'm not a doctor, and there's a lot of research, and they are in some ways thought to be connected. And some of the medications that are called off-label medications, so they're given, say, for one condition, but they were developed for another. Some of the medications that are used for migraine are anti-seizure medications. So there is a connection because there's a connection in your brain and in the brainstem, and in the blood flow and in your nervous system, as far as all those things are, and neurochemical changes that happen in the brain, all those things are affected when you have migraine, and also they're affected and they're part of the cause of it, and that also happens in seizures. And I haven't studied seizures, and I'm not a neurochemist either, but I do know that there is a connection.
Thanks, Jan.
Sure. And so I just wanted to go on with the descriptions a little more, if that's okay with you.
Absolutely, yes.
Okay. So there's also many people get what used to be called mixed headaches or combination headaches or combination migraine and tension headache. And now those descriptions have been folded into migraine, but a lot of people who have migraine also have symptoms of tension type headache, especially the ones that I was describing about neck and shoulder and back of the skull involvement, and this feeling like there's knots or stuck places. So I work with those too in the hands-on therapy. So that would be called what used to be formerly known as mixed or coexisting tension type headache and migraine. Then there's another kind of headache that's called cluster headache, and I haven't seen a lot of those personally. They're very different than migraine, and they're known as the worst pain. Sometimes they're even called suicide headache because the pain is so bad that there has been incidents of suicide. And they have different types of symptoms. You know how I was describing where people with migraine want to lie down in a darkened room and just be really, really quiet and still? And that's because any movement, just in the slightest incremental movement, can make their throbbing and all the other symptoms I described worse. With cluster headache, it's different. People don't want to stay still. It's more like they pace the floor. They're said to have to bang their head against the wall. It's described as a knife going into stabbing sensation going into one eye, and then often that same side eye and same side nostril will tear. So those are the symptoms of cluster headache. So I touch on them in the book, but I don't talk about them as much because I really haven't had as much experience with them. However, I will say that some people who have been described with cluster headache actually have the symptoms of migraine. And so they are able to successfully go through my program and my therapy, even though their original diagnosis is with cluster headache. And then another thing that I'll just say about clusters, the reason that they're called cluster headaches is that they come in clusters of time. So you might have them for like several in one day, like episodes that occur, like might be 1 or 2 or maybe even 8 times a day. And then that might go on for a day or for days or even weeks, and then they'll disappear. And they might not come back for 6 months or a year, and then you'll get them again. They were originally thought to be more prominent in men and also more prominent in male smokers. One of the original researchers, Dr. Lee Kudrow Sr., whom I met in the early 90s, he had me come to his office and was really interested in my therapy and really encouraged my work. He did a lot of research on oxygen for cluster headache, and that makes me wonder if the breathing therapy that I teach people in the book and in my sessions with them would also perhaps be helpful in cluster headache. So those are the 3 main types that I cover. And then the 2 other main types that I talk about in the book are dangerous headaches, which are the kind that are caused by other conditions. So an aneurysm, a virus, flu, meningitis, other things that can be causing the headache that are signs of real danger. And so it's advisable, even if you have or haven't been diagnosed with whatever kind of headache, that you consult with your doctor or go to the emergency room right away. Mm-hmm. And then the other type of headache that I talk about that's really insidious is called medication overuse headache. It used to be called rebound headache or transformed migraine, and that's when people who take medication for their headache, and that can be over-the-counter medication, that can be prescribed medication, and these are usually relief and pain preparations, and also even preparations that contain caffeine or even caffeine itself can cause what's called medication overuse headache. And that can occur surprisingly with a pretty small amount of medication intake. So, and that depends on the type of medication that you're taking. So from about 10 times a month, which is only 2.5 times a week, to about 15 times a month. So it depends on the type of medication. You can get medication overuse headache. And that means that the medications that you're taking to help you can actually, once your system gets used to them, it requires that you take more. And some of those medications do have barbiturates or opiates in them. But again, like I said, caffeine, which is in some medications, and also just your regular coffee and tea. If you have it often enough, it can cause this rebound where when it wears off your system, and starts to get out of your system, that your body requires more.
So it sounds like, Jen, essentially symptoms of withdrawal.
Yes. And so what happens is that the headaches become worse and more frequent. And the pain changes to more of a dull, daily, consistent pain. And so it is. And so really, it's surprising because also the medications that were first developed, the triptans that were first developed for headaches, migraines specifically, to abort or relieve the migraine pain and that particular episode, were thought to not cause overuse or rebound headache. and they were developed in the early 90s. And then it was found about 10 years later, or they were developed before that. And it was found about 10 years later in the early 90s that actually, or early 2000s, I should say, that actually they were could cause rebound. And then the other thing that happens is that often people take medications in combination, and they don't realize that that all adds up. So they might be having some tea or coffee in the morning, and then they might have their afternoon iced tea or an iced tea with lunch, and then an afternoon caffeine pick-me-up. And then they might have a medication over the counter pain preparation that has caffeine. And then they also might have their prescription medication. So all those things combine to add up. So that's the fourth type of headache or fifth type of headache that I discuss in the book and that people need to be aware of.
Thank you, Jan. We are speaking with Jan Mundo. She is the author of The Headache Healer's Handbook, a holistic, hands-on, somatic self-care program for headache and migraine relief and prevention. And you can find her at theheadachecoach.com. She's also going to be hosting an 8-week online course working through the Headache Healer Live is what you called it, right?
Yes, Headache Healer's Handbook Live.
Headache Healer's Handbook Live.
It's a mouthful.
It is. I mean, it's a pretty big book. So if we're going through it on our own, it would definitely take quite a bit of self-discipline to pace ourselves and consistently do it. So this 8-week program, it sounds like, is a really good way to get a little bit of hand-holding and also some community support.
Yes, absolutely. And it's also going to be video conferencing. So when it comes to the hands-on work that I have some illustrations for in the book that I actually did myself.
Oh, wow.
Then they'll be able to see those techniques done live. And so I think that will be helpful for people to really see and be walked through it, to have a live demo of it.
Absolutely. Thank you, Jan. So you talked about the types of headaches. And one thing, you also have a whole list of things that could be potential triggers, and also it might not just be one thing that's a trigger, because you've mentioned as an example alcohol. Sometimes alcohol can be a trigger. It could be one type of alcohol, one brand that might trigger it, or it could be having it along with something else, or some other conditions or circumstances or stresses that happen. So it might not just be one thing. One thing I notice is if I'm talking with someone and they're backlit, there's a light behind them, that can be a major headache trigger for me, because I guess it causes eye strain.
That's really interesting. Mm-hmm. And so can that just be anywhere? Like if you're at a party or you're in an office somewhere, or, it's just not necessarily on air when you're doing a video, but just anywhere? Anywhere.
And because I feel, obviously, if I'm talking face to face with someone, I have to look at them because it's rude to look away. And if they're backlit at all, it can be a really a big strain on my eyes, and I can find myself starting to get pain, and that makes it even harder to concentrate. So then I'm trying even more to concentrate, and I'm squinting, and this whole set of behaviors comes up to try and prevent the headache, and then I usually just end up getting a headache.
So that's really interesting on so many levels. So first of all, good noticing on your part, right? That you're starting to deconstruct one of the things that is a trigger for you, right? So can I ask you a couple of questions about it?
Sure.
Is it the light that's bothering you, or is it because their face is in shadow? What's your sense of that?
I'm not sure, because that is a good point. I am sensitive to light, so I'm a little more sensitive to the sun and to bright lights than the average person. But that idea about their face being in shadow actually could be part of it, because it's harder to make out their facial expressions and to really make eye contact. I think it's a combination of their face being harder to see because it's in shadow, and then also the bright light shining and that contrast.
Right. And so Do you do anything in that situation?
I'll try to have them move, or if I'm at a coffee shop and the light behind them is bright because it's the sun, like we might switch spaces, or I'll pull down the blind. But often I can reduce some of the backlighting, but if I want to continue having the conversation or continue the visit, sometimes there's not a lot I can do. It still continues.
Mm-hmm. So I think that that's great that you're trying to take care of yourself in that way. And I'd say more of that if I were coaching you. Mm-hmm. Because as you mentioned, I talk about combinations of factors in the book, and that's how I've worked with people for years. And so it's often not only one thing. And so you might even go deeper in your noticing. So the first thing that I think that you're doing is really great. And I would just say to keep taking care of yourself and pay attention to taking care of yourself even more. So what I was starting to say about the list is, there are the lists of triggers, and there are trying to pick those out for yourself and see what your personal combinations of factors are. And then beyond that, it's actually moving into action and doing what you can do to avoid those triggers. So you're doing some of that, it sounds like, really well. And so I would say, see if you can do it every time. And there are ways that you can do it that are graceful, and which I'm sure you do, where you can take care of yourself and the other person. Depending, of course, how well you know the person, if it's business or personal contact, but you're a very personable person, right? Mm-hmm. I mean, we've never talked, and we're talking now, and it's like I know you, right? So you could just make a simple request of someone. Do you mind if we just switch places, like you were talking about? Or, gee, the light's bothering me a little bit. I'm just going to turn the shade down, or maybe we could move to this other table even, right? Mm-hmm. So just keep moving toward taking care of yourself in that way. And then the other thing and you also know that you're sensitive to light. So maybe even the venue that you're in, or maybe if you're meeting with someone outside, then you have your shades on, right? Mm-hmm. You have a hat with a brim. You maybe stay out of the direct sunlight. Like, just keep moving toward taking care of yourself. And then the other thing is that it would be really interesting to me to see if all of those situations are equal for you. Like, what, if your cycle is involved at all, your menstrual cycle, mm-hmm. like maybe that's a factor. If you've had sufficient protein, sufficient water during the day, that could be a factor. And then also the tension in your body. So maybe there are certain situations where you're more comfortable with someone and you're more at ease, and maybe you don't have a lot of tension in your neck and shoulders or your head and face. And then maybe there are some situations, and it can be really subtle. It doesn't have to be somebody you're totally uncomfortable with, but maybe there's just a little more tension in your body, and you're holding those areas that I mentioned a little more tightly, mm-hmm. or holding yourself a little more, with less movement or less comfort. And those can also factor in. Or maybe, like you were saying, maybe you're straining to see. And even that musculature and the fascia, the tissue that surrounds all our muscles, that's more strained, say around your eyes and your cheeks. Sometimes I call it social face. The people who have a job, say a sales job or some kind of a job where they're always interacting with the public, and they have kind of this smile. It doesn't mean it's necessarily fake, but it just gets held in one position for a long time. And then, you're kind of then by yourself, or you finally get to relax, or say you're meditating, you just let it all go. So any of those factors that I mentioned could possibly play in. So that would be interesting to see if even the times where you said you're taking care of yourself by switching around how you're sitting, where you're sitting, and where the light is relative to the other person, that maybe those other factors in your life and lifestyle are playing in without you realizing it. And so maybe that also combines to bring on the migraine or the headache afterward.
Mm-hmm. And then combined with alcohol or coffee or something like that, it adds a whole other layer. Thank you, Jan. Yeah, I mean, the book, the Headache Healer's Handbook, is really an opportunity for us to become more aware and more mindful of our bodies and the sensations that we're feeling, and then also the things that, we're thinking and feeling, the way we're holding our bodies. You go through posture and things like how we're carrying our handbags or our backpacks and things, or especially, this is a big one, you probably have something to say about this, is the way we're all looking down at our smartphones.
Totally. And even with kids, you can see it. Developing this, we have bent neck posture now. And so I admittedly like to scare people, especially women, to say, oh, you're getting a premature hump in the back of your neck, because that was always thought to be hereditary with, or, having to do with certain abnormalities. But really, if we always have a head forward posture, which is so if we're looking down at our smartphones or our various devices, or even holding our heads forward and into the computer to see or to look at something, or even when driving, like straining forward to see, it all has to do with head forward posture. So that's like carrying a bowling ball out in front of you all the time. And the muscles that you're using to do that aren't your arms. Muscles that you're using to do that are your shoulders and your neck. So one of the things that people can work with is to bring your head back over your shoulders. And so one way to do that is to align and to look up. So you kind of have to hold your device up at eye level, as opposed to always looking down, or have your neck so it's not bent, so that you're not building up these muscles in the back of your shoulders and neck. So, but one of the ways that you can align your posture is to simply just tap the side of your ear, tap the side of your shoulder, and tap the side of your hip. You want those to be, if you're seated, you want those to be in a vertical line. So it's like a plumb line, drop down into gravity. And if your ear is way forward, so that your ear is on a diagonal line to your shoulder, then it's forward. And that can even happen in easy chairs when you're leaning back, or couches when you're leaning back, like, oh, I'm finally relaxing, and you lean way back, right? But you have to bring your head forward often to look at what you're doing in front of you, if you're watching TV or you're reading on your device. So even when you're leaning backward, toward the back, your head can be forward. So you want to keep, and it's not a one-off where you just say, okay, I've aligned myself for the day and I'm done. It's one of those things where it's like it just creeps up on us. And as much as I know and have taught people, and as much as I've practiced myself, I always have to keep coming back to realigning my posture. It's basically stacking your body, ear, shoulders, and hips. And then if you're standing, that would also extend to your knees and feet. And also one way to start this posture is when you're sitting in your chair, to start with your feet in this alignment, where your feet are about hip distance apart and they're not tucked under you. You know how we put our feet kind of tucked under us on the chair?
Yep.
You want them to be, your thighs to be parallel to the floor, and your legs to be perpendicular to the floor, and your feet to be about hip distance apart. And that way, your weight can drop down from your hips into your feet. So you're not really literally holding yourself up and keeping your tension in your upper body. And the other thing that people do, I'm talking more about sitting at desks rather than just being on our devices, which is where we started with this, but I'll do it because I'm sitting at my desk right now, is that people use their desk chairs, they use the arms on their desk chairs. And a lot of times that holds their shoulders up because they're usually too high for most people. And so I advise to not use those arms or chair arms when you're sitting at your desk. So to just get a chair that doesn't have them, or just not use that part of the chair, or see if you can remove them so that you're not holding up your shoulders. So all those things keep us basically held up high in our bodies.
I noticed, Jan, that I have a desk that I can adjust to sitting or standing, and it's not a question of I can see the screen fine, but as soon as I get really focused on something, I realize that I automatically immediately start putting my head forward.
Right?
The
That's
focus, it's like, oh, this is how I focus. But it's not like my vision of the screen is any different if I have my head and shoulders in proper alignment.
I know. We just get sucked into it, what we're doing. You know, it's like we're really drawn into it. I know. I do the same thing. And that's why I was talking about, it's like you have to make a loop between your body and what your body's doing. You know, what the object of your visual field is what you're talking about. And it sounds like visuals are also a factor for you too. So that's part of it. But, you know, and then sometimes it's good to, I notice when, and I even have glasses that magnify, but sometimes it's important to increase the size of the print, the type, and everything on your screen. So that can help too. It brings it to you more than we having to lean in to decipher it. So people can adjust that. I mean, it's like all these little things that we just take for granted of how we use our body. And that's one of the things that I find so fascinating about working with headaches and migraines, is that it's always different for everybody. Just these little factors that can add up that we just take for granted about how we use our bodies. And the body is largely left out of medical treatment. You know, it's a whole body phenomenon, and all the things that happen to us involve our whole bodies. And so it's really important to involve the body. And that's why I work with breathing and posture and meditation and self-massage, so that all these areas that in ways, and like you were talking about how we carry our stuff, our backpacks and our bags, and how heavy they are, and we just take it for granted. It's like, oh, I'm lugging this around. This is everything that has to go into it. But sometimes when you break it down, like, you don't really have to have all that, or you can carry lighter things. It could be a lighter wallet and a lighter key fob, and all these different things that, oh yeah, I've been carrying that around for a week, but I'm not really using, but it's just in my bag. All those kind of things we can adjust, and those will help. And so really, devil's in the details. I help people become aware of how they're using their bodies all throughout the day, and also when they're sleeping too, and just hanging out.
And a lot of this, I think, starts in childhood. I mean, now, back when I was a kid and you were a kid, we played outside more and things like that. But nowadays, kids are often on their devices or on video games. But even just carrying backpacks, I remember getting a lot of pain and headaches from carrying a backpack starting in elementary school, because we'd have these huge 30-pound textbooks we had to carry around.
I know, it's so true. And so, you know, I have seen a fair amount of kids and teenagers who do have headaches and migraines, and they're going through that too. And so I always suggest, even though it might seem a little nerdy for some of them, but they're hipper and hipper looking, you know, that's probably a really old term as well, but ways to carry around your stuff as far as different wheelie bags and all that. And things that might be able to be kept in their lockers, or perhaps they will go to more devices rather than heavy books, and then learn how to use them so that their head isn't and their neck isn't bent down. But I know it's really something, and that produces head forward posture as well, because if you're being pulled back by 30 pounds of books, then in order to not be pulled over backwards and fall flat on your butt, you have to lean your head and shoulders forward and neck forward in order to balance the weight so you don't fall over backwards. So that's also creating that kind of head forward posture and the build up. It's almost as if you're lifting weights with your shoulders and the back of your neck, and it creates an actual buildup, just like you're building up your biceps doing arm curls. So it's really something that parents and kids need to be aware of, because earlier and earlier, like you're saying, the bad postural habits are being created.
Thank you, Jen.
Yeah.
Sorry, you wanted to add one more thing?
Well, my dad was an orthopedic surgeon. I remember he used to come behind my shoulders and kind of, tug on my shoulders to make them not be forward. And it's kind of a thing, it used to bug the heck out of me when I'm thinking of it. But it actually was what you want to go for. And all the heavy carrying of backpacks and kind of the slouchy sitting and all that are creating bad posture really young and can have an influence later on in life. So it can seem trivial at the time because kids' bodies are so much more pliable and flexible and resilient. They bounce back. But then over time, these habits get built up and their musculature gets built up in those ways, and then it can cause problems later. So it's important for them to look at it now when they're young.
Thanks, Jan. So we have been speaking with Jan Mundo. She's the author of the Headache Healer's Handbook, a holistic, hands-on, somatic self-care program for headache and migraine relief and prevention. The book is very comprehensive with illustrations and lots of questionnaires covering posture, diet, stress, water, like the things that we're eating, the drinking enough water, a whole bunch of things, the way we sleep. If you want more guidance on this, you can also go to Jan's website, theheadachecoach.com, where she's going to be hosting an 8-week online course that will have video conferencing as well, so you get a better idea of these exercises, the techniques that she's using. We're almost out of time, Jan. Headaches are such a complex issue. We could probably talk for days about this. What do you feel like is the most important thing that listeners and potential readers of your book take home today?
That I think it's important that they look at combinations of factors in their lives, like what we were talking about when I was talking to you. Like some things might be obvious and you think but some things might be less obvious. And so I think that it all starts with curiosity, of being curious about and being aware of your day-to-day habits and your lifestyle. And so if they can start to look at combinations of factors and try and look at the details and see the cause and effect, that can go a long way towards solving their headache or migraine mysteries. And the thing that I'm really curious about right now is, how are you feeling and how's your headache?
My headache has improved throughout the conversation, and I'm now sitting, as you said, I've got my hips and my head and my ears in much better alignment and my feet on the floor. It's a lot more work than just slouching back in my chair, though. I've gotten lazy.
Yeah, that's what happens. When we build up those muscles in correct alignment, then we'll hurt ourselves a lot less. So what seems like a relaxed posture a lot of times is using our bodies so that they're not aligned in gravity, and we can learn to use them in gravity, and in the end, that will support us a lot better and cause us a lot less pain. So sometimes it seems unnatural when you're first doing it and a lot more work, but in the end, when you get used to it, it's just like any other habit. It's whatever you get used to, but it will cause less pain to use your body in proper alignment than using it in what we think is quote unquote a relaxed posture.
So a little more effort up front to train ourselves to sit properly and to take better care of ourselves is going to end up being less effort and less pain and suffering in the long run.
You said that beautifully. Exactly.
And is there anything else you want to add, Jan, before we say goodbye today?
Yes, thanks so much for having me on the show. And I hope that this was helpful for you and for all your listeners.
Thank you. Well, I know there's a lot of people out there who suffer from various types of headaches, so I hope that everyone has found this helpful today. Again, Jan Mundo has been our guest today. You can find her at theheadachecoach.com, and the name of the book is The Headache Healer's Handbook. Thank you so much to Jan for her time and for sharing her knowledge and experience with us today. And thank you for being with us. I want to send you lots of